to keep moving to our next incredible speaker, Alexis Rose Hinckley, who is a ridiculously awesome registered nurse. Y'all know, a content creator. And Alexis is going to share with us why we need to protect Medicaid as well. Alexis, I'll toss it to you next.
Hi, everyone. I want to start off by saying, Anne, that was a beautiful display of vulnerability. Thank you for sharing your family's experience with us. And thank you all at home for being here today. My name is Alexis. I'm a nurse in Southern California. I'm not a politician. I'm not a CEO. I'm someone who wakes up every day and goes to work caring for the people in my community. And I'm here specifically to speak out because what is happening to our healthcare system, especially in regards to long-term care facilities and rural hospitals, is not just wrong, it is very dangerous. I'll just say it plainly, Medicaid cuts will kill people in specific populations, rural communities, disabled folks, and the elderly. Those cuts hit the hardest. Every day, I care for people who rely on Medicaid. Seniors in nursing homes who can't walk or feed themselves, adults with disabilities who deserve respect and dignity, mothers, fathers, neighbors, veterans, people from all walks of life. In our long-term care facilities, budget cuts mean neglect for our patients, our parents, our grandparents. Why is this? Because in a for-profit healthcare system, profits are prioritized over people. So when a budget is cut, staff ratios explode. Right now, before these cuts have even happened, many long-term care nurses are responsible for 30 to 40 patients. One nurse, simply put, cannot be in 40 places at once. That's not safe. That's not care. That is exploitation. And it's not what our elders deserve. But Medicaid is the top reimbursement contributor for these facilities, so cutting Medicaid means leaving the elderly without any help or nurses with an insane burden, both at work and mentally. No one goes into healthcare to neglect people, but these facilities are already putting staff in impossible situations all the time. In our rural hospitals, those precious lifelines for small towns, Medicaid is the difference between staying open and shutting down. I've seen what happens when the funding dries up. Emergency rooms close, maternity wards vanish, and people drive hours just to see a doctor. El Centro, California is a rural agriculture town. They just lost their birth center because of this exact issue. So now residents in the Imperial Valley have to drive either 2 hours east to Yuma, Arizona, or 2 hours west to San Diego just to see an OBGYN. If an emergency happens, that can mean death. And that is the fate awaiting rural hospitals if these cuts go through. And the crazy thing is, none of this saves money. It just moves the cost somewhere else. It means hospitals spiking prices of procedures and care to offset losing Medicaid dollars, which increases the overall cost for everybody. So yes, this will affect everyone, regardless if they are on Medicaid or not. Not to mention the personal burdens on families and the funerals that did not need to happen. The bottom line is, we're not talking about policy. We are talking about people. So today I'm asking everyone, do not stay silent. Do not let them cut our care away without a fight. Speak up for the grandma in the nursing home. Speak up for the farmer who can't afford a hospital that's 2 hours away. Speak up for your neighbors, your kids, your future, because healthcare is not a privilege, it is a right. And Medicaid is a promise that we made to care for our most vulnerable among us, and a promise that we have to keep. So please call your lawmakers, be relentless. Their staffers need things to do, trust me. And tell them our lives are not on the chopping block. Thank you all for having me here today. I'm honored to stand beside all of you in this critical fight to protect our communities and save our healthcare. Ashley, back to you.
Alexis, the honor is ours. Can we show some love to the nurses in the chat? Y'all, like, I mean, most of us would not make it had it not been for these nurses that are out here literally overworked, underpaid, right? Like out here saving lives every day. And these experts who are seeing it firsthand are telling us that we have to fight like lives depend on it, right?